Great. And thank you very much for having me to speak with you about our learning resource, Anatomedia, which stands for Anatomy and Multimedia. And it's also an acronym for a new approach to medical education developments in anatomy. And it was developed at the University of Melbourne with my co-authors, who you can see here. And I think our project leader, Norm Eisenberg, will join us for some questions afterwards. And it was also completed with the assistance of our publisher, McGraw-Hill Education. And yeah, the University of Melbourne is where it was developed. So there are a lot of current challenges in learning anatomy. I'm sure you are aware that it's been very difficult during COVID-19 to get access to the dissection room and really good university quality resources. And it's also been challenging to find learning materials that are truly interactive and engaging and keep you interested on going through your study of anatomy. It's a very content-rich subject, and it's very challenging for students. So the way that Anatomedia can help is by providing access to those resources from home or anywhere you want, and that you can do it on iPad or laptop, and it is its content is able to complement any curriculum, whether it's a systems or a problem-based learning curriculum or a regional curriculum where you study each body area region by region. It helps to maintain student engagement by having a principles base to learning, which is where we try to help you learn through understanding rather than through just rote or repetitive learning, and to also incorporate a lot of functional and clinical applications, so you can see that how it might make you a better practitioner in future and what is the clinical relevance of the anatomy you are learning. So we really wanted to try and improve the student learning experience of studying anatomy. So the way we structure Anatomedia, the base image layer is always a real image. So it might be a real prosected specimen you can see on the left of the thorax or the chest. And then on the right, we've got a real medical image of a living body. So these are from real cadavers or real living bodies. And then on top of that, we superimpose in colour, in using semi-transparent overlays, the structures. So the nerves in yellow, the arteries in red, and the veins in blue, and organs in that pinky colour or orange, and they're very consistent throughout the program. And we also superimpose on the image on the right, there are some linear markings to really help you identify the bones. And by being structured in this way with these multiple layers of the image, it makes it very assessment oriented, because you will be examined generally in tertiary study on a real cadaver specimen, which is quite complex and difficult to distinguish the structures. But when you put on those semi-transparent overlays, you can immediately see, well, there's the artery, and here are the kidneys, and here is the renal veins. And so, and on the right, it helps you to distinguish the important structures. So there's a lot of blood vessels there, but then you can really clearly see the coronary arteries, those important coronary arteries supplying the heart. So within an Anatomedia, there is always a text box on the left, and a text box on the right, and an image box on the left, and they are both interactive. So you can turn on, using these little buttons down the bottom, the overlays or the colours to highlight. In this case, we're looking at muscle attachments of the humerus, And then on the right, any text that is italicized can also be clicked on, and that's got the important components of that image, in this case, the muscle insertions. So you can click on the italicized text and then roll over any of these little labels. And in this case, the one we've rolled over and it's gone white is the deltoid tuberosity for attachment of the muscle deltoid. So that's quite interactive and enables you to test yourself on those important structures in the image. And it's a really good way to practice for exams and tests. Also on the right, there are these underlined texts, and they bring up short answer style questions. So if you wanted to find out something important about the humerus, for example, where is it vulnerable to fracture, you might click on this question here, the key sites and clinical significance of fractures of the humerus, and that will bring up the sites where the humerus is commonly fractured, and then and what is the clinical significance of that? So how can that be a problem and manifest clinically? So you get this instant feedback, but it's very useful for learning. So a lot of the learning is through questions and self-testing. And it's got a very concise text, and there's a lot of diagrams in those little answers, which there's 2,000 of them, and they're quite unique diagrams. They're simple, but they're quite memorable. For example, on the left here, we're showing the arrangement of the veins around the arteries to conserve heat, and so when blood is flowing through the limbs, the deep veins are always arranged around the arteries for thermoregulation, or to maintain heat in the body. And this one down the bottom is a nice diagram showing the principles behind rest, ice, compression, elevation, or the principles of managing acute inflammation. So it's very useful for visual learners because it's got lots of images, real and diagrammatic. The design is quite simple. You need to choose a module. So we usually start with general anatomy, which is introductory and principles and concepts of anatomy. And then we go through from clockwise, top right and around, head through neck and limbs and the trunk. So when you enter the program, you need to choose a module, and then you choose within that module. Each of those modules has 4 perspectives. The 2 on the left, systems and regions, they cover the theoretical content that you will cover in your lectures, systemic anatomy for a problem-based curriculum, or regional anatomy for a traditional curriculum. And the 2 on the right is really all of your practical content, so what you will be come up against in practical classes, both dissection and medical imaging. So you need to choose one of those, and you can see when you enter any screen of Anatomedia, it tells you exactly where you are. So these 3 buttons up the top, the first one tells you which module you're in, the second one tells you which perspective you're in this case systems, because we're looking at the bony structures, and somatic systems, and the specific part of the musculoskeletal system we're looking at is the skeletal system in the upper limb here. Okay, so it's pretty easy to find out where you are. And there's also on the top right, there's a search button. So if you wanted to find something specific, for example, the deltoid tuberosity of the humerus, you can go into that search engine and either look for it alphabetically, there's an alphabetical index, or you can just key in the exact search terms you want and find the information. Within the program, it covers all of the major body systems, and these are in the general anatomy module. So that's really looking at anatomy from a more of a functional perspective. So all of the muscles are covered together. And this dissection on the left, for example, these are all dissections from an entire cadaver. It took 400 hours to dissect all of the muscles of this left specimen. It's all the superficial muscles are on the right and the deep muscles are on the left. And then we've got a dissection of the entire central nervous system and major nerves and plexuses coming off that, again from an entire cadaver, and then the gastrointestinal tract, and in this case the arterial system. So each of the systems are covered in the whole in general anatomy, and that's a really good overview. And the regions covers more the spatial arrangement, so how anatomy in different areas relates to each other. So we cover the borders of each module. So how does upper limb get separated from the thorax, for example, or the neck? And then within each region, so in the lower limb, so within each module, I beg your pardon, so there's 8 major modules, and within those there are a number of regions, and they're delineated very clearly. So this is a bit more of a surgical way of looking at anatomy, and you can see that the regions are also described very accurately within the trunk, and so the borders and the contents and the relations of the structures within each of those regions. So it's pretty methodical. In systems, we cover conceptual anatomy, things like the dermatomal supply of skin, or the segmental supply of skin, and why it is arranged that way during development. And we also cover functional anatomy, for example, how the intrinsic muscles of the hand act across the interphalangeal joints to bring about different movements. So it's very interesting and practical. And it also covers the anatomy relevant to clinical practice. So you can see, why do we position a unconscious patient in this recovery position? And we cover that in the head and neck to try and maintain their airway patency. And it's the surface anatomy is also covered in regions, and that's quite relevant for a practical exam if you're going to get examined on living subjects. And it's great preparation for seeing patients to understand what the surface anatomy represents underneath. So what are those curves and bony landmarks on the skin representing beneath? In dissection, we go from superficial to deep, layer by layer. So each of these layers actually takes 20 hours to dissect, and then on top of that, we can superimpose in colour the structures. So it's got the benefits of a matched colour illustrated and photographic atlas, but you don't have to try and match them up yourself. They are perfectly matched in here, and it's got more information than a textbook in that there's lots of layers, so you can go all the way through and back, and it's a bit more like a serial dissection or doing your own dissection. Then in the trunk, so this is the abdomen here, we cover unembalmed or post-mortem anatomy as well as embalmed, and you can see they appear very differently. So the small intestine, for example, and the large intestine look really easily distinguishable on autopsy, but on the embalmed it's quite tricky to see the difference between the two. So you've got these vivid colours, but most students, medical students, don't ever get to see in their undergraduate experience an autopsy or a post-mortem view of anatomy. So it's a fantastic thing to have in the program and to help prepare you for surgery, and how things will look very different in that situation. We cover the anatomical basis of practical procedures. So in the upper limb, we look at how you can get intravascular access and do nerve blocks, for example. And in imaging, we cover all types of medical imaging, from X-ray and sectional anatomy to CAT scans and contrast studies of the blood vessels, MRI and ultrasound. And on ultrasound, it's quite difficult to distinguish the tissue, so we use those colour overlays again to highlight in that reddish brown colour the muscle, and in green is the connective tissue here, and the pale yellow is the fatty tissue. And we've also included endoscopy. There are key images from an endoscopy, but we also have the video endoscopies are included. We try to include any latest methods of medical imaging, so there you can see the full video of, for example, an arthroscope, of the shoulder or the knee joint, for example. And you can also, there are some rotating three-dimensional images of the blood vessels in the neck, for example, and new concepts in anatomy like lymphotomes, which are the lymph drainage, how that is arranged from different regions of the body. So they're all incorporated. It's programmed in HTML5, so you can use it in any of those, formats. And our project leader has just joined us sometime. So we're just looking at the testimonials and to see that we've had a number of really great feedback from students saying that it's a great asset during COVID when students are limited to online study and missing their anatomy classes. It's useful to help you test your knowledge with the quizzes and the questions to prepare for exams. It's also it enables you to continue learning from cadavers when you cannot access them, which is fantastic. And probably the most enjoyable comment for us to read was this last one, that the students love the principles-based approach, which is learning anatomy through understanding, and to help them see that anatomy is not just memorising, but that it's actually fundamental to becoming a better practitioner or a better clinician or a better anatomy teacher. So this is, I'd just like to acknowledge our team. We've all worked very hard, but the whole project would not have been possible without the body donors who we've tried our best to honour them, and the students have been a great source of encouragement and inspiration. And we've got a big extended team of clinical consultants, and we also had some grant funding from the Commonwealth, the University, and McGraw-Hill have helped us complete this project. So this is our bigger project team, including some of the multimedia people, in 1997, and it's taken us 25 years. So you can see this was actually 20 years later, and we were all, it lasted the distance for the 25 years actually, and 100,000 hours of work. So it really is the work of a lifetime for us, and really nice to be able to present it to you. Thank you, at a time when students really need good resources. So I hope you can make good use of it. And there are some additional things that you might be interested in your library. Is a copy of the General Anatomy textbook, which Norm is the prime author on, who's just joined us, Professor Norm Eisenberg. And there's also up on the Anatomedia website some guides, which are like a abbreviated text form of the Anatomedia notes. If you prefer reading text and from in a linear format that is very portable, then you might be interested in those. So you can find those on the website. And that's it for now. So over to questions, David.
Apparently, we don't have any question, Priscila.
You don't have any questions? Is it too challenging to talk in English?
I suppose.
Sorry, do you not have the facility for students to ask questions, David?
No, we don't.
Oh, that's okay. Well, do you want me to, do we have a few more minutes, David? Should I show you the program in action online?
Yeah.
Okay, great. I will just quickly get it loaded up. Okay. So you will actually access this through, the students will access this through their university intranet, but I'm accessing it through our website, anatomedia.com. And so after you sign in on your intranet. Oops. Oh gosh, sorry, it's making me sign in. Better not. Can you see my password? I hope that's right. Might not be. Oh, thank goodness. Oh no, this was right. I'm sorry. Oh dear, I'm going to need to look up my password. Sorry, just give me a second. Sorry, it doesn't usually do this to me. Annoying. But just when I needed it to work without the password, it didn't.
Esta es una presentación. Luego nos vemos ahí.
Hopefully that's right. Good. Thank you. All right, so now so when we come through the program, we need to select a module, which we might select, what have we not looked at? Let's look at, for example, the thorax. So we'll go to thorax and we'll go, so you can go straight to dissection if that's what you're interested in, and that's probably what most people really miss about not going into the dissection room is, and so from there we can just superimpose, go through. I'm actually just using the right arrow key to toggle through and go deeper. And each of these layers, as each of these dissection layers, as we said, we can highlight the various structures on the image by clicking the little tabs below. And yeah, you can, there's a little, that question mark is just a little guide that tells you what the different colors represents. But yeah, you can see me tabbing them there on and off. And it's great to test yourself. And then if you wanted to, for example, test yourself, you could identify an internal intercostal muscle by clicking on that. And then if you're not certain, you can click on it and bring up the title. So, and then there's some blood vessels we can see down there, the superior epigastric vessels. So that's really good. And then if we're a bit more, and you can see it goes right through. So it actually, we take off the thoracic wall and go right down to see the heart in close up. And it's really fantastic to be able to see important structures like the coronary arteries and major vessels, nerves surrounding the heart. But if we wanted to go, say if we wanted to test ourselves a bit more, there's not actually many questions, there's not many short answer style questions in dissection. They tend to mainly be in those theoretical perspectives. So if we go to systems, and let's say we were actually interested particularly in the heart structure, so let's go to I just clicked on the heart there on that overview screen, and here we've got a description of the borders and surfaces, and we can get a bit more information on each of those, and the axis of the heart, how it's oriented, and then we can just identify those, have a colour picture view of it, which is really great for you to have a visual image of that before you go into the prac exam. But then there's also, if we keep going through this, there's some really fantastic dissections, like of the fibrous skeleton of the heart, for example, which is quite rare to see a real example of that. But a lot of clinical questions. So how does the fibrous skeleton prevent the ventricles from contracting at the same time as the atria, for example, and it provides an electrical barrier that stops that, that really facilitates the heart being an effective pump by interrupting that transmission of nerve signals between the two. So there's a lot of clinical questions in there. And we go through in detail the atria, then the ventricles, the nerve supply. Again, these are really unique dissections and probably a lot more detailed than anything you'll actually see in the dissection room, because we had the luxury of 25 years to do it. And yeah, again, lots of clinical questions. So where's excitation of each cycle of the cardiac contraction initiated, and then clinical questions like why may cardiac pain mimic esophageal pain. But if you wanted to find a specific structure, so say we wanted to find the mitral valve, we could enter that in the search engine here, and what you can see when you bring that search engine up is that it lists exactly where it is. So these are in thorax, as you would expect, and you can see that if you click on that systems finding of mitral valve, you're going to probably come to about where we are. Frame 26, I think that is where we are. But if you are interested in learning about where to listen for, so also auscultate for the mitral valve, you might want to go to regions, and that will give you the exact spot to position to listen for the mitral valve contraction. And then also, if you wanted to see more of an image of the mitral valve, you could go to imaging, and here we can see an echocardiogram of the mitral valve and what features it has there. So you can see how you can really compare a dissection of the mitral valve with a medical image or a more theoretical perspective. So, and I forgot to say actually also, when you're first coming into the program, David, because you were saying you felt a little nervous about using it, there is also it's really very straightforward. All you have to select is one module and one perspective, but there is an introduction section. So just if you, I went to the home screen, and from there I select introduction. So there's an introduction to anatomy here, which talks about things like the anatomical position and
Anatomy is the study of human structure. It is derived from the Greek words to cut up. The units or building blocks of the human body are termed organs. For example, the stomach.
So you can see how that sort of goes through a very basic introduction of anatomy, and then there is a little 5-minute video on how to use Anatomedia, which goes through what I just went through with you, but yeah, probably in a bit less detail and a bit quicker. And then we've got this anatomical terms video as well. So
to avoid confusion in describing the location of one structure relative to another, a standard reference position has been adopted. This is termed the anatomical position.
So you can see there's 3 videos, and if you simply wanted to learn how to use the program, you'd probably go to how to use Anatomedia. But if you were starting anatomy, you might start with the introduction to anatomy and watch the anatomical terms videos as well. So hopefully that's useful. Is that, have you found that useful, David?
Excuse me, I had to attend someone here in the library. So, are you finished your presentation?
Yes, I am. So, but if anyone had any questions, my colleague Norm's here to answer as well. Or do you need to go to another talk now, David?
I think yes.
That's okay. All right. Well, best of luck using the program, and yeah, if you have any further questions, there's lots of information in that introductory section or on the website. And yeah, if you spot anything you think we need to know about, then contact us through Ada, the librarian, please.
Very well.
Thank you.
Thank you.
No worries.
Bye.
Take care. Bye.